السلام عليكم أعزائي الطلبة. Our lecture today in parasitology about class Trematode, genus blood flukes or other name Schistosoma. Element Trematodes. Flukes is the common name for any member of the class Trematode. When I say trematodes or flukes, I mean same. Trematodes are relatively simple flatworm and soft body. The fluke body insegmented and covered by tough cuticular tegument for its protection from digestive enzyme of the host. It possesses two suckers, one oral anterior in position and surrounding the mouth, and the other the ventral lying on the ventral surface. They have a blunt digestive system without anus. The only opening is the mouth. Also, most trematodes are hermaphroditic. I mean it's both male and female reproductive organ in the same element and capable of self-fertilization, except for Schistosoma, which have separate sex, male and female. Trematodes have complicated life cycle occurring in two or more hosts, involving sexual reproduction, which occur in mammalian and other vertebrate definitive hosts, and asexual reproduction, which occur in the snail intermediate host. All parasitic trematodes use fresh water snails as intermediate host. It's also trematode has a reproductive system in which uterus is the largest organ. It also have single ovary and two testes and series of the glandular structure that produce egg-shell material. Uterus may be filled with the thousands of eggs. Also, trematode may infect various organs of the human host, such as intestinal veins, urinary bladder, liver, or lung. Types of flukes. Flukes can be classified or categorized into groups on the basis of the system they infected by these flukes. The first one, the hermaphroditic liver flukes, which is occur in the liver, such as Chlorhonchus sinensis and Fasciole hepatica. The second one, the hermaphroditic intestinal flukes, which occur and attach to the mucosa of the intestine, such as Fasciolopsis bushki and Heterophyes. The third one, the hermaphroditic that infect ling and called ling flukes, which is occur in the ling, such as Paragonium. The fourth one, the bisexual blood flukes, such as Schistosoma, that inhibit the blood in some stage of their life cycle and live in the intestinal or urinary bladder of the host. Schistosoma blood flukes. Schistosoma is the most important trematode parasite. Its tiny flatworm lives in the blood stream of the warm blood host and undermine the health of the blood. They differ from other trematodes in they have separate sex. I mean it's have male and female. Adult exist as two sex but attach and contact to each other. The female found inside the male in a groove, the gynecophoric canal, where he continuously fertilized her egg. Also, the male worm resemble ruled leaf, where they bear longer and more slender female in ventral canal. They require two hosts, definitive and intermediate hosts, to complete their life cycle. Schistosoma is also only the trematode that invite the host through the skin. All other trematodes infect by ingestion. There are two differences from the other trematodes of the Schistosoma. They have separate sex and also they infect the host through the skin of the host. Schistosoma causes schistosomiasis or bilharzia disease and is the most important helminth disease. The of infection is through swimming in infected water. There are three main species of Schistosoma that infect a human. They have similar life cycle. The first one is Schistosoma manasoni, in which the adult worm live in the plexus of vein draining of the rectum and colon, and in the branching of the portal vein in the liver. It causes intestinal disease. The second, Schistosoma japonicum, in which the adult worm live in the interior mesenteric blood vessels and in the portal vein in the liver, and it also causes intestinal disease. The third, Schistosoma hematobium, in which adult worm live in the vein draining of the urinary bladder. It causes urinary tract disease. This figure shows the adult worm of the Schistosoma, in which it have separate sex, male and female. Also both sex have oral suckers and ventral suckers. The female found in a group in the side male, and each one which attached to another one. Life cycle. Human infected when the free swimming fork-tailed Cercaria penetrate the skin. They differentiated into larvae, Schistosoma, and enter the blood and carried via the vein into arterial circulation. Those that enter the superior mesenteric artery and passes into portal circulation and reach the liver, where they mature into adult flukes. Schistosoma manasoni and japonicum. Adult migrate against the portal fellow to reside into mesenteric venules, while the Schistosoma hematobium adult reach the bladder vein through the venous plexus between the rectum and the bladder. In their definitive venous side, the female lays fertilized egg about 6 weeks after infection, which penetrate the vascular endothelium and enter the gut in case of the Schistosoma manasoni and Schistosoma japonica, or invade the bladder lumen in case of the Schistosoma hematobium. The eggs are excreted and passed in the stool or urine and must enter fresh water to hatch. Once hatches, the cilia larva Neuracidia penetrate snail and undergo asexual multiplication, and to produce many Cercaria into water in about period 3 to 6 weeks later. The three species of the Schistosoma uses different species of the snail as intermediate host. Cercaria leave the snail, and Cercaria actively swim in the water and complete the cycle by penetrating human skin. This slide shows the life cycle of the Schistosoma. The life cycle began when the egg of the Schistosoma passes in the feces and urine. It passes in the feces in cases of the Schistosoma manasoni and japonica, and passes in the urine in cases of the Schistosoma hematobium. The three species of the Schistosoma differ from another in the shape of the egg. Then the eggs hatch in the fresh water and releasing Neuracidia, and then Neuracidia infected the intermediate host, the snail tissue, and inside the snail undergo asexual multiplication and convert to Cercaria. Then Cercaria in the fresh water released from the snail and infect the swimming in the fresh water and infect the human by penetrating the skin of the human. Inside human, Cercaria loses their tail during penetration and become Schistosoma, and then enter the circulation of the human and migrate to the portal blood in the bladder and mature into adult. Then the both sex of the adult worm migrate to the mesenteric venula of the bowel and rectum in case of Schistosoma manasoni and Schistosoma japonicum, and like egg and circulated into liver and shed in the stool. In cases of the Schistosoma hematobium, it's migrate to the venous blocks of the bladder and lay the egg in the urine. This life cycle completed usually in two different hosts. The infective stage for the human, which is carrier, and the diagnostic stage of the infection with Schistosoma was the egg. Transmission occur in fresh water, where the cercaria larva stage of the Schistosoma come in contact with and penetrate human skin. Humans are the main reservoir of infection, and humans are definitive host, while the snails are intermediate host. Dogs, cats, rodents, pigs, horses, and goats are reservoir for Schistosoma japonicum. And the figure show the Schistosoma free swimming fork-tailed cercaria. Pathogenicity. Most important pathology is caused by the presence of the egg in the liver and spleen or wall of the gut or the bladder. Therefore, the pathogenicity of the flukes varies with the site of the infection. Eggs in the tissue induce inflammation, granulomas, fibrosis, and obstruction in tissue, especially in the liver and spleen, and causes hepatosplenomegaly. Schistosoma manasoni damage the colon, inferior mesenteric venule, while Schistosoma japonicum damage the small intestine, superior mesenteric venule. The damage is due both to digestion of the tissue by a proteolytic enzyme produced by the egg and the host inflammatory response that for granulomas in the venules. Schistosoma hematobium damage the bladder venules, which can lead to the carcinoma of the liver. Clinical finding. Most infections are asymptomatic, but a chronic infection may be symptomatic. The acute stage, which began shortly after cercaria penetration, and it consists of dermatitis, followed several weeks later by fever, chills, diarrhea, malaise, lymphadenopathy, and abdominal pain that result from the enlargement of the liver and spleen. Eosinophil elevated in the number of the white blood cell, especially eosinophil, are seen in response to migrating larvae. This stage usually resolves spontaneously. Chronic symptoms may vary with species, but included bloody diarrhea in cases with Schistosoma manasoni and Schistosoma japonicum, or hematuria in cases of Schistosoma hematobium. The chronic stage causes significant mortality and morbidity. Diagnosis. Diagnosis is based firstly on the history of residence in the endemic area, swimmer, itch, and other symptoms. Stool or urine are examined for the egg by microscope. The egg are very characteristic and confirm diagnosis. When egg examined under microscope are distinguished by the span, and it's different according to the species. In cases of the Schistosoma manasoni, the eggs has a large lateral spine. In cases of the Schistosoma japonicum, it has small lateral spine, while in the cases of the Schistosoma hematobium, it has terminal spine. Also, serological tests may be sensitive and specific, but don't provide information about the worm burden or clinical state. This figure shows the egg of 3 species of Schistosoma, in which in Schistosoma manasoni, which has large lateral spine, while Schistosoma japonicum has small lateral spine, while Schistosoma hematobium has terminal spine. Treatment. Praziquantel is the treatment of choice for all 3 species of Schistosoma. The mode of action is not exactly known at the present, but experimental evidence indicates that praziquantel increases the permeability of the membrane of schistosoma cell toward calcium ions. The drug thereby induces contraction of the parasite, resulting in schistosoma paralysis. In the contracted state, tegument in the neck region of the adult element develop flukes which appear to be pierce and disintegrate. Praziquantel also produces intense vacuolization at several sites in integument of adult schistosoma. This is followed by phagocytic attachment to parasite and death. The effect is more marked on adult worm compared to young worm.